Today we are going to talk about symptoms of all types of Chiari malformation. Let's start with type 1. Headache is the most common symptom in almost 85% of the patients. It starts on the back of the head and radiates forward toward the vertex and sometimes towards the neck of the patient. The severity of the pain is increased by exertion, coughing, sneezing, head dependency, and sudden change in the position. These things create a change or increase in the CSF pressure and result is increased severity of the pain. Another thing is Valsalva maneuver, which also increases the severity of the pain when performed by the patient. The sensory symptoms when spinal cord is being compressed by the cerebellar tonsils are itching, numbness and tingling in the hands, changes in the proprioception. Its body's ability to coordinate the movements. So this proprioception is disturbed. Next is interscapular pain and Charcot joint in less than 5% of the patients. Motor symptoms which arise when spinal cord is being compressed by the cerebellar tonsils are difficulty in performing fine motor skills. Fine motor skills in the upper limb are like tying shoelaces, putting a plug into the socket or using pencils. Other examples of fine motor skills are shown here. Others are weakness of hands and arms, wasting and fasciculations. Fasciculations are rapid muscle movements or twitches which are limited to the individual muscles. There are absent deep tendon reflexes. In Chiari malformation type 1, there are no bowel and bladder problems. Other structures around the foramen magnum are also being compromised like brainstem. So the compression of brainstem also leads to some symptoms, which are cough, headache, neck and arm pain, downbeat, nystagmus. The next are symptoms related to cerebellum. These create disturbed quality of life and are more debilitating for the patient. The first is nystagmus, which is involuntary movements of eyes. The second is ataxia. Ataxia is simply poor muscle control. This poor muscle control will lead to walking problems like gait issues. The second is speech issues, which is dysarthria. Swallowing problems like dysphagia and abnormal eye movements. The third is dysmetria. Dysmetria is poor control or no control on the range of motion. So this will lead to vertigo, dizziness and other such symptoms. These are the symptoms of Chiari malformation type 1. Now we will talk about symptoms of malformation type 2. Type 2 is the more severe form of Chiari malformation because in this cerebellar vermis, fourth ventricle and lower part of brainstem are protruded through the foramen magnum into the cervical spinal canal. The symptoms usually start in infancy or childhood. It is associated with myelomeningocele and neural tube defects. The symptoms related to brainstem compression are nystagmus, poor sucking in the baby, dysphagia and aspiration. Aspiration can be the cause of death in some children. Wheezing and stridor can be positive and there is arching of the head in the children. Another more common symptom is apneic spells. The sequence of apneic spell is that the children is cyanosed, then there are anoxic seizures. After that, baby is exhausted or children is exhausted and then sleeps. Vocal cord abductor palsy, gags, seventh nerve paresis, abnormal eye movements and mirror movements. These are symptoms related to compression of brainstem. The patients of Chiari malformation type 2 present in infancy or early childhood. The symptoms related to spinal cord are spasticity in the upper extremities and weakness in the lower extremities, persistent cortical thumb, wasting of hands and scoliosis. The cerebellar and the most debilitating symptoms of Chiari malformation type 2 are nystagmus. The type of nystagmus here is horizontal nystagmus and rotary nystagmus. The child will fall so much and there will be gait disturbances. The next is dysmetria. As we have already discussed that it is poor control over the range of motion. So child or baby can't feed himself or herself. The symptoms of Chiari malformation type 3. Type 3 is a more severe form and it is associated with occipital encephalocele. This is the extreme form of hindbrain herniation, like the baby has low occipital or high cervical sacs containing portions of cerebellum and brainstem. It is very difficult to treat and the child presents with severe neurological deficit, developmental problems, seizures and respiratory insufficiency.